Welcome back from the first episode, and I'm excited. We're just going to jump right into it. Stay tuned for this second episode because this is the second half of the first episode. If you missed the first half, go back, watch it right now. You're going to get the most out of it on YouTube, but make sure that you watch this second episode because it's going to bring the whole thing together from the first episode. Stay tuned.
The problem is that when you stack your system, the guides are dependent upon the previous initial set of structures to basically create your starting point for your accuracy. So if your first guide did not seat properly, the rest of your stacking is not going to be accurate. And it's not linear relationship, right? And I'll show you what I mean by that. Because when you are off 1 millimeter, 1 degree, your next guide isn't going to be 1 millimeter, 1 degree. It could be 3 millimeters, 3 degrees off. There are lots of parts and pieces to position, mate, and assemble, just like what I said. And then with all those parts, the pricing and time increases. So it takes time for the lab to manufacture. It costs more to manufacture the different parts and the different material that they're made of, whether it's metal or a combination of metal and resin. And then the turnaround time is a little bit slower too, because you have to assemble everything. And I counted, I think, an average of about 11 pieces per arch when you do the stacking system. And your turnaround time then increases, and then you can do your surgery in a timely fashion for your patient. By the way, these guys here, these are the most painful Legos to step on. I know because I have kids. But why am I bringing up Legos? I'm bringing up Legos because when you think about Legos, they have a tolerance where you could make 10,000 of these and they could say, okay, well, if 100 of these fit together, that means that we can make a bunch that are the same and they all will fit together. We can't do that with your patients because every patient's different. We don't have a chance to build 10,000 of the same thing. So each time we create something, whether it's coming out of the machine a certain way, there's lots of variations with that machine, whether it's printing or milling, we don't get a chance to multiply that by X number of tries to make sure we dial in the tolerance. You know how many tries we get with each patient? 1. We get 1 shot at making sure that everything fits. And that's why in the stacking system, you have bigger holes. Why are they bigger? Because they're there to accommodate the tolerance of error. All right?
Hey, got an important announcement for you. We are hosting the second annual Full Arch Advantage event where you learn to create, convert, and close more full arches so your office can grow the way that you want. This is going to be in partnership with BioHorizons, and this is our second year, but the important part is it's going to be virtual, so you don't have to fly out, buy hotels, travel with your team. You can just register and block off the days and watch virtually. And right now we have early bird pricing. It's never going to be cheaper than right now. I don't even have a discount code because it's so cheap. It's only $199 right now to register. And it's for your team. It's for your dentists. It's for your treatment coordinators, your dental assistants, and your marketing managers. And you're going to learn a ton of stuff to grow. Last year's event had a 74 NPS score, which is amazing. And the feedback was really, really good. So if you're looking at leveling up, we have a ton of new content, a ton of new automations and things that you can add to your practice to really grow, and executing on the phones to make sure that you can grow the way that you want. So don't miss this. Go to Full Arch Advantage right now and sign up. This price will not be around for long.
All right. One more thing about stacking. If you had to guess how many degrees is a Leaning Tower of Pisa tilted, what would you guess? This is a world-renowned monument that everybody knows globally, right? It's in postcards and pictures and everything. Think about that. How many degrees? Okay, think about that in your head, and you may have an answer. It's only 3.97 degrees. That's crazy, right? Like you would think that thing is off by like 20 degrees. Because visually what happens is when you go further away from your starting point, you're going to get accentuated perception that that thing is off by a lot more degrees. So if you imagine stacking your guides, and then by the end of that stack, you realize that you're off, it's too late. You've already been to this part and you're done with the prosthesis already picked up in the mouth. And that's why there's a higher potential for adjustments and reaming out the prosthesis to get the patient to bite down on the stacking systems. So now you know what's out there. I'm going to show you a few things here, a little bit outside our realm of dentistry. You guys all know what this is. This is a Tesla, of course. But what about this? I live in Reno, Nevada. We're near a mining community. There are lots of mines out here. I took my kids out for some adventures in the tunnels, and I took pictures of this because a tour guide was telling me what this is. And what you're looking at here are batteries. These are batteries that were made in the late 1800s, early 1900s for the purpose of an electric car. Now, you would think that the electric car has just been around for the last, maybe a couple of years because of how popular Tesla has become. But that's not true. There's been a lot of inventions, a lot of goals, a lot of ways to get to the same goal. This vehicle here was the first documented electric vehicle that's very similar to a car, and that was in 1909. Check these guys out. 1970s, 1980s, 1990s, and in the 2000s, right? So 70s, 80s, 90s, 2000s. The point is that Tesla wasn't the first. They were the first to solve the most problems. And I'm not saying that I've solved all the problems of guided surgery when it comes to full arch, but I believe that we've come up with something that has simplified the process, and I'll show you how that is. So we don't stack our guides. We're going to deliver to you small occlusal holes on your prosthetics, which means stronger, more aesthetic results with minimal to no adjustments. We have these patent-pending simple seat abutments, and I'll show you how they all work in a little bit. But they control the shape of the insertion so that you're not dealing with a bunch of tall cylinders. We make all our prosthetics out of nanoceramic, so you'll see that there. Some of our partners, obviously, we have SMC as one of our favorite partners, Proceed Finance, Stella Life, and a couple of labs, Chameleon ADL, and we also do One Tree Planted. Let me know if that's something that you guys are interested in. We can talk a different time. SMC, a little plug for them. This is a part of a presentation, so you guys can probably skip this part here. But we include Stella Life with all of your cases as well to help your patient recover better. This is an all-natural, non-opioid solution for post-operative care. All right. So let's do a full arch. I want to show you a case study here. So this is Dr. Billy Cho and Dr. Michael Lum out of San Diego, Carlsbad area there. This is a double arch, one of my favorite cases to showcase because they had previously been guided stacking users, and they came across our product. They wanted to try us out and see how it goes. So we're doing this upper full arch so the bone reduction gets on the anatomy, keeping some of those anatomies that you're seeing on the screen right now. And in between those areas, we're going to reduce the bone. Okay. Bone is reduced. We're going to keep those areas where they need to support the guide. The first guide comes off. The second guide goes on. Same position of supports. And we're referring back to the known anatomies. See, the problem with the stacking system is once you take off the anatomies, you don't have a reference point to check back if you're in the right place. You're hoping that that stack is correct every time. With ours, we're referring back to your records. So if you've taken thousands and thousands and thousands of patients' impressions and scans, clearly we can rely on your records. So the patient's anatomy is being used as our reference points. So implants go in, and then the remaining anatomies get reduced so that you're essentially reducing bone to the adjacent flattened surfaces. There's no need for a guide for that part of it. You're going to screw down our simple seat abutments. Our prosthetic mates into the bridge, and then you're going to inject flowable material through the buckle ports. And I recommend doing Lexatemp because it is dual cure. You can do light cure and self-curing. And here we go with the prosthetic, and you can see what that looks like. Notice here, there's no apparatus to hold it in place. There's no connections. There's no guide in the way. Everything is open. Everything is basically trusting the system that it works, okay? So now if I wasn't telling you the truth and this is all smoke and mirrors, then the lower arch would not fit, right? Because it's a double arch. So the accuracy should be really, really good. Because 8 times out of 10 that I've been in surgeries with stacking systems, the lower arch, when you're doing a second arch, ends up being in the wrong bite. So here's the lower arch. Lower bone reduction. Bone is reduced. First guide comes off. Second guide goes on. Implants go in. Multi-units go on. And then our special simple seat abutments. And we provide block-out straws to make sure that screw channels are protected. Prosthesis mates into the cones. And look at the bite. It goes right in there. Little to no adjustments. Okay, it's clean. It's fitting. The whole procedure. This was their first time using our product. The whole procedure was about 2.5 hours. I would say probably about 2 hours and 45 minutes per arch. So we were done by about noon. We started pretty early in the morning, and we went through the whole thing, and it was done by about noon. All right, so next one is Dr. Kim Power. She was a Stanley Institute attendee in 2022. This is a full arch upper. This case started out pretty quickly. The reason why I'm showing this case is because it only took her about 8 months before she studied our system. She started with small cases, and then she grew the confidence in our system to do a full arch. And within 8 months, she was doing her full arch here. So what you're seeing here is a bone reduction guide. And the bone is reduced. Reducing the bone here. The first guide comes off. The second guide goes on. And you can see how everything is intimately fitted. See, the fixation pins have already been positioned in the anatomy. So if you can't get it in there, you're not in the right place. Okay. Surgery takes place, and we're going to put the implants in. She's just trimming some of the excess bone that's sticking up. We have a rotation guide for the multi-unit to be positioned in the right place so that we can synchronize all the different multi-units together. So you can see the angle at which we are basically showing her to go. Multi-units are in. Our simple seat abutments are seated on the multi-units. And then our bridge goes in. She finished this case in about 2 hours. Bite's looking great. And she's putting in the block-out pins to protect the screw channels from getting blocked. Injectable material. And there's a conversion. Bite was not even adjusted on this one. You can see the midline's spot on. All right, this is one more case, and then I'll get to some of the details here. This is an upper full arch. This is Dr. Michael Ferguson, Dr. Gabrielle Richard from Louisiana. full upper arch. Again, the bone reduction guide is seated on selected anatomies for the purpose of support. And here he is reducing bone in between the supports. Sorry, it's a little blurry here because I was further away. The operatory was a little bit larger on this one, so it's a little bit harder to get good angles. First guide comes out, second guide goes in. And now we're doing the surgery. Implants go in. The second guide comes out. We're going to put in the simple seat abutments on the multi-units. So if you guys are seeing the videos that I'm showing here, he's basically trying to put in the screw channel blockers so that those parts do not get stuck in there. And then he seats the bridge over that. Nice and firm. And then he injects some material through the buccal ports. Okay, so the one thing that I want to note here is that he's injecting the material really quickly. You want to go with a steady 1, 2, 3, fill, 1, 2, 3, fill onto the next. If you do it too fast, too hard, you're going to end up over squirting that material over the top. But check this out. This is not even adjusting. It's right after we did that part of it, bite goes right in. Guys, I'm telling you that this system works, and obviously I'm biased to my own product, but I'm showing you 4 arches in this presentation where the bites go in because it's designed to do that. Okay. I want to provide you with the best and most efficient way to doing your full arch cases. I believe this is one of those ways to do that. And you can see how accurately the bite is. If there's anything that I could say about where doctors spend the most time on any full arch cases, is the prosthetics. The surgery, you can kind of go quickly because at the end of the day, as long as you have the implants and decent bone and you got it covered, that part of the procedure is for the most part done away with. And then where the prosthetic lands against the opposing, that's where the things get really difficult, right? And this is what the patient sees. This is what I was talking about earlier. If you squirt the material too hard, too fast, you're going to end up looking like this. So just be careful when you're filling up the injectable material. You would suture after that. So while your assistant's polishing down the prosthetic, you're suturing. And then you can... Here's a result. Great implants, great position. And look at the clock. It's 11:40. So we started that right around, by the time he was sedated, anesthesia and everything was done. I think we started around 9:30 or 9 o'clock, something like that. So about 2.5 hours afterwards. So the records that we need an open bite CT, we need a closed bite, upper and lower digital impressions or conventional impression, photos, and then submit everything to our website. That's pretty straightforward. And then the timeline is, so we've got one of the fastest turnaround times available out there. From start to finish, not from approval, from start to finish, I could get you back your case in 13 days or less. Okay, so 3 days for the records for it to be processed. We plan, we produce it, and you get it back in 13 days from when you submit the case, as long as we get everything that we need and that there's no delayed information that we didn't get. Okay. So what about final restoration? This is one of the newer topics that I want to talk about. These are pictures from different stages of the lab. They're not of the same case, but they convey the same information. Okay. So when you're doing a conventional process of records and you're doing a final restoration, there are lots of going back and forth. So you got to do impressions. You got to do more impressions. You've got to do the model work and the copings for the verification jig. So appointment 1, you took the records again. Appointment 2, you got to bring the patient back in for this thing to be tried in so that you can make sure the verification jig is confirmed. Basically, it's our way of saying we got to check your work, right? You're basically taking impressions and we're saying we don't trust it. You got to check it for us. That's what it is. Okay, so then it comes back. We got to redo a verification jig because, hey, lo and behold, it didn't fit. So then you have to resect it. And now we got to do another one that is a verification in appointment 3. Then we do the lab work to create a wax trim or bite block. And then you got to bring the patient back in so that you can try that in again to capture the vertical and the bite. Now, I understand that there are shortcuts now, but I'm telling you, this is the kind of the conventional mindset as to why this is now obsolete in my mind. So now you've got 4 appointments that you just brought the patient back into. Appointment 5, they're finally trying the teeth in the mouth. Okay, so you took, 5 appointments to get to this point. And then that comes back and we got to adjust anything that were changed, right? And then by appointment 7, you're finally getting your final restoration. Once again, I know that there are shortcuts. I know that you can combine some of these steps, but if the case does not allow you to combine some of these steps, you're looking at about 7 appointments before you get your final restoration. Okay. How would you like to do it in 2 or 3 appointments? And it is possible. So we have a workflow now where we do the digital intraoral scans. The next step 2, is try-ins. In step 3, you get the final prosthesis. Some doctors that we work with have already skipped step 2 because of step 1 being so accurate. And because our surgery and our provisional immediate load stage that you saw the 3 case studies from were so accurate. And the way we do that is by using scan bodies that's compatible with us. And you're looking at only $2,000 per arch. And to my promise earlier, I said, I want you to get your patient the best product. Well, I'm going to give you the option of either doing zirconia or hybrid ceramics so that I'm not changing the price based on the material. I only charge you more if you don't do exactly our workflow here. So your initial investment is basically the scan bodies, the screws, and the drivers. That's it. You're only spending about $50 per screw, per implant, per case going forward from then on. If you do it conventionally, you're spending about $900 or more per arch with parts each time you do a case. So you've reduced your costs and your efficiency so much better now. So you scan the prosthetic in the mouth against the opposing. You scan the opposing and the surrounding tissue. You scan the scan bodies and you send everything to us. That's all you need. There's no going back and forth. Everything's digital. All right. And here's what you get. Once again, scan records, number 1. You're going to get accurate scans from your awesome scanner. Step 2, try-in, that's optional. Some doctors go directly to number 3. All right. So this makes it so much easier and less daunting for you to implement this in your practice. And I can show you how that all works. I can show you how that all implements together very well. We also have a way for us to design, and you approve the treatment plan. We'll design a product for you, and then you print. So that's rolling out this spring. So stay tuned for that. In the meanwhile, please visit us on Instagram. We do a lot of case studies. We do a lot of cool new products that we post on there that you guys can take a look at. And also S3Smiles.com is our website. So if you want to get started with us, please visit us there. So anyway, thanks for your time, everyone. I appreciate that you've taken the time to to check this out, and hopefully we'll be hearing from you.
Awesome.
Thanks
so
again.
much. Thank you so much for coming on. This was really, really good stuff. I'm sure the crowd's going to love it. We'll see if YouTube allows us to play this on there. I don't know the rules of that, but we'll see. Thanks so much for coming on.